Statistics Canada team. Patricia All graduated from the University of Ottawa in 1995 with a Bachelor in History and Social Sciences, and then she joined Statistics Canada, where she played several roles touching data collection, education, health and social surveys, and has spent several years in questionnaire design and qualitative research. She led the General Social Survey Program, redesigned in 2010, and then took over the management of the time use survey in 2013. She participated in many international projects related to time use, where she built her expertise. She chairs the UNSC expert group on innovative and effective ways to collect time use statistics. She has recently been given the management of the Care Economy project, along with the Caregiving and Care Receiving survey. And Dana Ray. Dana has a PhD and she is an analyst at Statistics Canada, focusing on the development, collection, and analysis of data related to time use and care economy. She played a key role as a researcher on Statistics Canada's Care Economy project and is the lead author of the conceptual framework on the care economy. Apart from her work at Statistics Canada, Ray has taught and published peer-reviewed research in the areas of unpaid care work, family policy, and gender inequality. So I would like now turn the call over to Dana for her presentation.
Thank you so much. Let me go through setting up my PowerPoint first, but while I'm doing that, thank you so much to the program, to everyone for the invitation to be able to come discuss the Care Economy project. We're really excited to share this with you all today. So as Saide said, I'm Dana Ray. I'm an analyst and a researcher at Statistics Canada. I've been working on the Care Economy project since its inception in about 2021, and I also work on the Time Use Survey. My colleague Patricia Uhl is not able to be here right now, but hopefully she'll be able to be in a bit later when we do the Q&A. So today I'm going to talk to you about Statistics Canada's Care Economy project, where we conceptualized the care economy for the purposes of research and data development at StatCan. And I first want to start off because I'm assuming if you registered, you may be familiar with the concept of the care economy, especially in the past few years where it's gained a lot of prominence. But if not, I want to put forward why the care economy is important. Why should we care about the care economy? So the ILO projects that 2.3 billion people will be in need of care by 2030. And this includes children, older adults, and also adults with disabilities or long-term conditions. And researchers, policymakers, and advocates have been putting forward issues related to care for many decades, but the shock of the pandemic has really shone a spotlight on this crisis of care in Canada and internationally. So it's really brought these issues to the forefront of a much wider audience. We know from many years of research that the care economy is particularly important because the care work that people do is very unevenly distributed within our society. So women, especially racialized and immigrant women, tend to do a disproportionate amount of care, whether it's paid or unpaid. The care economy is also interwoven with other pressing social issues, and I've listed a few out here on the slide, and I'm sure you've heard about many of them. And then finally, it's really that Canada's care economy is key for the prosperity of Canada's economy and societal well-being, again, according to these researchers, policymakers, and advocates who have been studying this for a long time. So to go into a little bit about why the care economy is not only an important issue, but is going to develop and become even more important, I want to highlight some of the demographic pressures that Canada is facing that might put pressure on systems of care. So the first, most obvious probably is population aging. So the population aged 85 and older is the fastest growing age group, this group of the oldest of the seniors. And it's projected to more than triple over the next 25 years from about 870,000 in 2021 to 3.2 million potentially in 2068. At the same time as we have the aging of the population, we have a slow and steady decrease of fertility, at least pre-pandemic. And in 2022, recent study came out that shows that Canada's total fertility rate has dropped to a record low. In addition to this, we also see more diverse living arrangements. So over the past 20 years, we've seen a 45% growth in multifamily households. So this could be multi-generational households. This could be multiple census families living together or a census family with other unrelated people. We also, in the 2021 census, saw that one-person households are now the most common for the first time in history. And this is also linked to population aging, as many of these one-person households are seniors or older adults. And this is not common across the population evenly, as I said before, but things like multi-generational households are also more common for immigrant or racialized groups. And that leads me into my last point about the demographic trends, which is immigration. So immigrants are often disproportionately work in paid care. And what's more, they're usually in lower paid, lower status jobs. On the unpaid side, or just about care more generally, the growing linguistic and cultural diversity in Canada may impact the way that care is provided by putting more pressure on unpaid care if paid care services are unable to address the sort of ethno-linguistic diversity. The care economy is also a key labor issue. So the demand for care has been growing. And again, the pandemic really sent a shockwave through this. So the Canadian Medical Association, for example, found that the demand for long-term care in 2019 was about 380,000 people who were in need of long-term care, and that they projected this to increase to 600,000 by 2031. So that's going from 29.7 billion to a projected 58.5 billion for long-term and elder care by 2031. Childcare is also an area of demand, even as we see decreasing fertility. So since 2021, the federal government has put into place an early learning and childcare plan. We've seen a huge growth in children under 6 being in childcare. So from 42% in 1995 to 60% in 2019. And at the same time, especially post-pandemic, the difficulty for parents and other caregivers to find childcare has increased. So 36% in 2019 said they had difficulty finding childcare, now 49% in 2023. The supply of care in terms of paid care workers is also a critical issue that's come up a lot over the last little while, often tied to supply of healthcare workers as well. So using the 2016 census, a recent study at StatsCan showed that 1 in 5 workers are in care or care adjacent occupations. And here we're speaking pretty broadly, not just about those who are directly caring, but also those who support care industries or locations. And women accounted for 75% of all of these care or care adjacent workers. And to give an example, in the 2016 census, there were approximately 500,000 workers in the early learning and childcare sector. And this is a much narrower swath since it's a bit harder to put together a picture of paid care workers for seniors and adults with disabilities. But when looking at only home support workers and related occupations, there were over 100,000 in 2016. And to continue on this about the impact of the care economy on the market economy. So this is this fictive graph just to show where the overlap is and where we might be missing some pieces. So part of the care economy, notably paid care work, is already included in our measures of GDP, even if we don't necessarily disaggregate to know how much it contributes. But what we are missing in terms of the care economy when we're looking at traditional economic measures like GDP is the enormous amount of unpaid care work. So this unpaid care work goes unrecognized and devalued, even as it supports these systems of paid care. And the pandemic was a really important example of this. So as paid care services shut down or they were limited, so much of this care burden was shifted once again to unpaid carers like family or friends. But this is not captured in our economic estimates. So we may be underestimating the scale of the burden. To maybe give a sense, there has been some recent research that has tried to estimate or assign economic value to this unpaid work. So in a recent study from StatsCan in 2019, unpaid household work was valued at between 517 to 860 billion, depending on the methodology used. And so unpaid household work, to be fair, includes but is not limited to care work, but this at least gives a picture of how enormous this unpaid sector really is, right? That's 25 to 37% of GDP. Another more recent study done by researchers at the University of Alberta has tried to estimate the value of unpaid care work for those with long-term conditions, disabilities, and problems related to aging. And they estimated this at 97.1 billion in 2018. So that's 4.2% of GDP. We don't really know what the valuation of unpaid care is for all children, so including those without long-term conditions or disabilities, which is another really important component of the care economy, as I'll get to soon. And again, because we have these valuations of unpaid care that are starting to come out, but we already know that paid care is integrated into GDP, but we haven't really had a chance to put the two valuations together to really know what does the total care economy contribute to Canada's economy. So for part of this presentation, I wanted to go over how StatsCan's Care Economy project came to be, how it sort of developed, how we went from this conceptual foundation and built it up along with consultations to reach what we have now. So the Care Economy project launched in May 2021, so about a year after the pandemic started. And it was housed as part of the modernization of social statistics under the General Social Statistics Program, which I work for at StatsCan. And in part, the project was launched in response to growing demands for more data and knowledge on care. So for example, in 2021, there was a report of the Standing Committee on the Status of Women that recommended that StatCan more properly and more frequently collect data on and track unpaid and caregiving work. The 2021 federal budget also discussed care economy explicitly and mentioned care nearly 400 times throughout the budget. In 2021, we also saw a commitment of $100 million for gender equality in the care economy internationally outside of Canada. So right as the pandemic struck, you can really see how the emphasis shifted to suddenly dealing with this crisis that had been enlightened in the care economy. The Care Economy Project also launched in response to and with external researchers. So, for example, Professor Ido Peng of the University of Toronto has a project, Care Economies in Context, which examines Canada's care economy as well as others internationally. And we also at StatCan entered into a knowledge partnership with Nora Keating and Janet Fast at the University of Alberta, who helped and worked with us on this conceptual framework of the care economy. Now, the project has gone through three main stages, of course, either done non-linearly, more iteratively. So in the first phase, the project really focused on knowledge building. So the project was originally led by Jane Bedetz, who was a former assistant chief statistician at StatsCan, who came back to lead this project. And as I just said, we also collaborated with two professors from the University of Alberta, Janet Fast and Nora Keating, in this phase. And so here we're really focused on trying to map out and do the groundwork of what is the care economy, according to whom, what is the research and advocacy work that's being done in Canada and internationally on this issue. As the issues of care became more pressing during the COVID-19 pandemic, words like care economy tend to be sort of used a lot, but not necessarily very clearly or with a clear definition. So part of this knowledge building phase was really to try to track down how are people using the term care economy and what does it actually mean when we try to use it. In this phase, we also conducted consultations with a wide variety of internal and external stakeholders. So this included experts and academics, care organizations, and then also federal policy departments like Women and Gender Equality and Health Canada. So in the second phase, we moved more into what I'll call the conceptual development, which is where we tried to put together systematically a conceptual foundation for the project and the concepts moving forward. And this, again, was sort of iterative with the knowledge building phase. So we would go back and forth and going back to partners and then coming back with the insights and integrating them in. We developed, most importantly here, a conceptual framework, which really tried to outline the scope and boundaries of the care economy. And this was taking into account the Canadian context and the data needs of stakeholders. This is also the most challenging phase because like many big all-encompassing or umbrella concepts, there are a lot of different approaches, definitions, boundaries, scopes, depending on the research question, the country context, the data available. So this was really trying to narrow down what is most relevant for Canada and for Statistics Canada. In this phase, we also mapped out the data that Statistics Canada already has to see what we already had at the agency, but also to try and identify any gaps that may be existing. And I'll talk a little bit about data holdings later, of course. And in this phase, we also had the chance actually to develop some not totally, but some exploratory data for a wave of the Canadian Social Survey, which we fielded in mid-2022. And so partially this was drawing on the data mapping exercise by drawing on previous content that we had, but also trying to create new questions and test them to see how can we really try to get a comprehensive picture of the care economy. And again, I'll talk a bit more about why that comprehensive approach is maybe lacking later. And then here we are in this third phase, really, of knowledge sharing. So we have put out a report on the conceptual framework. And so that's all of that work of those first two phases kind of summarized down and presented to the public. We also have some research on unpaid care that we've been doing using some of the content that we developed for the Canadian Social Survey. And then finally, like with this webinar, we've been trying to engage in outreach and knowledge mobilization with local and international stakeholders. So we've also presented to the United Nations and other international partners who are looking into the care economy as well. This is more for when the slides get shared that, there's some links that you can easily access, but basically, as I said, we published a report on the conceptual framework that is available and that tries to summarize down the sort of what research exists already, and then what is our sort of proposed framework and definitions. We also have on Statistics Canada's hub on gender diversity and inclusion statistics, we have a highlight that tries to compile research at StatCan on the care economy, right? So research on topics related to care economy that may not have used that term before, but trying to show people what is available on these different domains. The Canadian Social Survey Wave 6, which is the one we developed the content for, is also available in research data centers, and initial findings were published and released in November 2022. And then actually next Tuesday, a week from today, we have research coming out on unpaid caregiving and especially focusing on sandwich caregiving. And if you didn't know, next Tuesday, April 2nd is National Caregiver Day. So we're going to be releasing new data from the Canadian Social Survey, a study that was funded by Women and Gender Equality. So let me move on to conceptualizing Canada's care economy. So as I said, we have this report out on our conceptual foundation, but I wanted to present to you what the sort of boundaries were, what we ended up developing. And I'm more than happy to discuss why some of these decisions were made in the Q&A. Of course, when trying to put together any framework, there's a real balancing act between being succinct enough to have a useful concept that can be applied to data, to research, and yet being somewhat loose enough that it can be adapted in the face of, let's say, data needs or information gaps. So what is the care economy? I see my slide. I left off my sources, but to say that this conceptual research, again, was informed by consultations with our stakeholders, but especially by previous research, and was sort of adapted for the Canadian context. But by no means is this sort of original, brand new definitions. These are sort of adapted and cited from previous research. So in the conceptual framework, we define the care economy as that sector of the broader economy comprising the provision of paid and unpaid care work that supports the physical, psychological, and emotional needs of care-dependent persons. So again, fairly broad, but highlighting a couple of important things here that I want to talk a bit more about. So care-dependent groups, our definition and our framework kind of specifically pointed toward these groups of people. And these are people who require long-term help with activities of daily living to live and participate fully in their communities. And we identified two of these groups that we felt were most relevant, again, for the Canadian context. This is children under 15 years, and they need long-term help with these activities because of their young age. Then the other group is adults and youth over 15 years old who have long-term conditions or disabilities or often problems related to aging. So these two groups were chosen again because we felt that they were the most in need of care, let's say, in the Canadian context. And I'll explain a bit more why when I talk about now what care work really is. So in this conceptual, I should maybe preface by saying that what care is and what care work is an area of hot debate. It has been for many decades. There are many different definitions of what care is exactly. So this is the definition of care work that we wanted to put forward in this conceptual framework that was appropriate for the definition of care economy as we put it forward. So first of all, and importantly, this care work could be paid or unpaid. There's always a bit of a blurry zone here because there are, for example, there may be tax credits or programs through employment insurance that do pay people to care, but ultimately we define the paid care side as the care work that's done usually for a job or some other formal contracted agreement. The unpaid care side is care work that's generally done by friends or family because of a personal relationship, or it's done by volunteers through some sort of organization, or without an organization, but volunteer work. So care work can encompass two different sorts of activities, and here our partners and experts from University of Alberta sort of guided us toward this distinction between ADLs and IADLs, which I'm sure many of you in the webinar are familiar with. So more direct hands-on care are the activities of daily limitation, or ADLs. So this could be feeding, bathing, other sort of what we think of when we're thinking of direct or hands-on care. On the other side, care work also encompasses this more indirect, perhaps more complex tasks of care, so instrumental activities of daily living, or IADLs. So this could be help with cleaning, this could be help with transportation, coordinating schedules of paid care or other services. So it's these sorts of tasks that aren't necessarily hands-on face-to-face, but that many care receivers need help with. And the focus here for care work and why the care dependent groups become so important is that we focused it in on long-term care using some of our survey definitions. This would be about 6 months or more. That necessarily comes from external sources. And when I say necessarily, I'm trying to distinguish between the fact that all people really receive and give care to one another. But in this case, the care dependent groups are those who need this care from an external source, whether it's paid or unpaid, in order to live independently and function fully in their communities. And with the focus on ADLs and IADLs and this long-term focus, we really were taking a social perspective on care, right? So not necessarily as much medical, but this social perspective on what does someone need to be able to participate fully in their lives. And so I want to speak a bit more about this social care because often the most common question we get is, okay, where does the care economy start and end, right? Where does it overlap with healthcare? Where does it overlap with education, the service sector, these other broad sort of sectors? And so most crucially, we use this concept of social care, which is more common in places like the UK or even different countries in Europe, to try to distinguish long-term care focused at these activities of daily living from more short-term acute medical care. They can overlap, absolutely, but they're ultimately distinct in many ways. And social care, again, often referred to as long-term care in many contexts. It's generally aimed at providing those with long-term functional limitations, help with either these ADLs or these IADLs. In contrast, what other researchers who publish on social care and other advocates, especially in the UK, in contrast, they say acute medical services really aim to cure people in the shorter term or to treat a more well-defined problem. Importantly, why we went back to this concept of social care was to try to help draw boundaries, in particular in terms of the paid care workforce. So we didn't want to say the care economy is the entirety of the healthcare sector or the care economy is the entirety of the sector of education. Boundaries can absolutely be blurry and they can overlap, but having too broad of a definition means that basically all jobs become included as care work and we're left with essentially a different definition of the service sector in some ways or of other sectors. So again, this balance between trying to be precise enough that we have a useful and distinct concept for the care economy while not trying to sort of encompass everything. And let me give you an example of some of the blurrier boundaries between social and health care. So this is an example we've given many times in our engagement process with stakeholders, but an example of a licensed practical nurse, right? So we know that they do provide what we would consider healthcare more, or what we would consider more the acute medical care, and then what we would consider the more long-term social or supportive care. But they're doing both of this as part of their job. And depending on where they're working or whom they're working with, the amount that they do each may vary. And so it's very difficult to get a sense of who's in and who's out in these definitions, which is why we tried to put forward this concept of social care and childcare, while still leaving it for the moment, at least as a suggested definition without explicit boundaries. And so all this conceptualizing aside, really what some key questions are that we identified for that need to be answered from this care economy perspective, this more comprehensive perspective, are who provides paid and unpaid care in Canada, right? Who are they? What are their characteristics? What groups do they maybe belong to? How much paid and unpaid care is provided? What the qualities of care are, so the intensity of care, especially for unpaid caregivers, the amount of time it's provided for, who's receiving the care as well, and what they're receiving care for, what the impacts of caregiving are for paid and unpaid care workers, which is a really salient question, especially with Statistics Canada's focus on measuring and the quality of life. What supports might be provided for unpaid caregivers in Canada and also for paid caregivers. And then finally, what's the magnitude of the economic contribution of the care economy? So that's a kind of a bit of a brief summary there of our conceptual framework, which again, there is a report out that you can read more, and there's much more precise details in there. But for now, I want to switch over to talking briefly about Statistics Canada data on the care economy. So what came out of our data mapping exercise? So I'm going to provide a summary of some of what we see as the key sources for data on different types of care. I'll maybe address this a bit more later on, but I want to emphasize probably something that if you've come to one of these webinars before, you may have heard, but one of the challenges here is that as I'm giving this broad level overview and as I work specifically in social statistics, it's hard for me to tell you whether there would be data for your specific need, local need, regional need, especially when it comes to a lot of the surveys that we conduct at the national level. It can be challenging to get a picture exactly of what's happening below the provincial or regional level. Not necessarily impossible, but challenging. So I wanted to present this overview of the data and then some of the challenges that we see with using this data without getting into the weeds of which survey can answer which questions necessarily. So for unpaid care, we have two sides, right? Those who provide the care, the caregivers, and those who receive the care. And so for providing the care, the majority of data comes from the General Social Statistics Program on which I work. So we have the Caregiving and Care Receiving Survey, the Time Use Survey, and the Survey on Giving, Volunteering, and Participating. And then we also have the Canadian Social Survey Wave 6, for which we developed content. On the receiving care side, again, the caregiving and care receiving, as the name implies, has information from the care receiver's point of view, not just the caregiver's point of view, which is, of course, incredibly valuable. The Canadian Survey on Disability also has some questions for those adults living with disabilities for the care that they receive, although they're a fairly more limited set of questions. And then the occasional survey, the Canadian Health Survey on Seniors, which is, I believe it's an occasional supplement of the Canadian Community Health Survey, also provides some information, but again, specifically for seniors or those over 65. On the paid care side, so most of what we know about providing care, at least at the national or StatCan level, comes from the census and the labor force survey, which of course the census in particular, of course, a large sample. And the LFS also has a lot of detailed information on the types of jobs, the pay of jobs, the job conditions, etc. We can also look more on the paid care side, on the economic side, toward administrative data linkages that exist that try to link some of these surveys or census data to different administrative sources like tax data or business data. These, the LFS census and some admin data linkages, tend to be more from the perspective of individual respondents, so individual paid care workers. But there's also business level data from surveys, for example, in the nursing and residential care facility survey, which looks from the facility or business or firm level at what's happening. You know, how many paid care workers are employed? What are they doing on average? How does the business work? And then from the use of paid care services side, so here talking more either from the caregiver or care receiver's point of view of what paid care services they may be using. There's some information on this on the caregiving and care receiving survey. And we also have different surveys on early learning and childcare arrangements in particular that have been looking over into the use of childcare services. There's less, to my knowledge, again, from this overall point of view, there's less on the use of things like home care or long-term care. So since the GSSP is where I work, I wanted to give just a little bit more detail on what is available. So here from the picture, the side of unpaid care, these three surveys are sort of the key ones to find out more about unpaid care. So there's the caregiving and care receiving survey. The most recent data for this is from 2018, and it focuses primarily on care dependent adults and also has some limited data on children with long-term conditions and disabilities as well, at least on the side from the perspective of the caregiver. For unpaid care provision, we also have the time use survey. This looks at care to both children and adults, but we don't necessarily specify in the survey the care dependence of these adults. So whether they do have a long-term condition or disability. And this data were most recently collected in 2022 and will actually be released in a few months in June 2024. And then finally, so as part of the Care Economy project, we were actually able to put questions on the survey on giving, volunteering, and participating. So now there are a few questions on volunteering related to this sort of care economy framework for both care-dependent adults and children. And this survey is currently in collection, and the anticipated release wouldn't be until about 2025 or 2026. So again, very sort of broad level overview, and hopefully when the slides are distributed, all of that information can be helpful to look into a bit more if you want to. But what I want to do now is highlight some of the challenges that we face in the data that we already have at Statistics Canada, but also if there are data outside of Statistics Canada, or if you or your organization are considering collecting data on this, what are some of the challenges and gaps that we've found? So the first is what I think has been illustrated by the many different sources of data and the sort of many different definitions all over the place, is that it's very difficult to paint a comprehensive picture of the care economy. So a lot of these issues, it's not just related to StatCan surveys or something like that. A lot of these issues tend to be siloed, right? We look at unpaid caregiving. We look at the paid care workforce. We look at caregiving to children, or we look at caregiving to adults. There's often not a ton of overlap, or sometimes not even a lot of dialogue between the different areas. This is not true universally, of course, but there's can be a disconnect, and this shows up in the data. But of course, the reason we want to paint a comprehensive picture of the care economy is to understand the totality of it. And I can talk a bit more about that later. Data on unpaid care work. So as I showed, especially from the general social statistics program, we do have a good amount of data, and it stretches back historically as well. So for example, the time use survey has been in collection every 5 to 7 years since 1986. And then the caregiving and care receiving, the same thing every 5 to 7 years since around, I think, the mid to late 90s. But the frequency of collection is often slower. So as I said, every 5 to 7 years. There's also little way to supplement these social statistics with administrative data. So while we can gain really interesting insights on paid care and the paid care workforce from administrative data linkages, there's not much about the social side in tax data, let's say, about how many hours people provide or what they feel the impact is on their well-being. And the challenge with unpaid care work is, though, even though we have a wealth of data on this, it can often also be disconnected or not fully aligned with things like the conceptual framework or other definitions or concepts we want to put forward. For data on paid care work, one of the primary challenges I would say is the lack of specificity. And this is not necessarily a criticism of the data whatsoever. The census, the LFS, they're all meant to address much broader issues, not just the care economy. But when it comes to trying to narrow down to who exactly is in the paid care workforce, as that example I gave us of the LPNs shows, it can get quite difficult. And that's why I'm saying that when we draw boundaries around this or propose a scope for the care economy, it can be perhaps arbitrary is not the right word, but it can be difficult to hold firm on a boundary because depending on what you want to look at, these boundaries can change quite a bit. Different occupations or industries can be in or out. So there's just a lot of variability when you're using these broader data sources that aren't necessarily targeted at paid care work. Another issue on paid care work is that there are no existing data that we know of that really report on the sort of more social side of what paid care workers are doing. So that would be the types of tasks, the types of care, the amount of time they're spending on this, and so on. There are also some challenges that we face in collecting and analyzing data on different ethnocultural or racialized communities, on Indigenous communities and Canada's North. So for example, most of the General Social Statistics program does not collect in Canada's North nor on reserve. So Indigenous persons are underrepresented in our surveys on care. We also don't necessarily have a great way of adapting surveys necessarily to different understandings of care. And this was brought up by some of our stakeholders, particularly those who work with Indigenous communities or racialized groups, that the way that people perceive and identify themselves as caregivers may be very culturally dependent. And so depending on the way that questions are asked, we may or may not be capturing the real experiences. And then in terms of analysis, as I said before too, about sample size, right? We face challenges, even though we want to follow Statistics Canada's disaggregated data principles, right? Of trying to look at specific groups as opposed to generalizing or homogenizing these groups. This can be difficult due to the sample size that sometimes exists, especially when we're getting into very specific outcomes like caregivers for a certain group on a specific outcome. And then finally, maybe quite relevant for this webinar would be that survey data in particular can be challenging to look beyond regional or provincial levels to things like health units or municipalities or urban areas or whatnot. And again, primarily an issue of sample size. But I also wanted to highlight the unique or maybe not unique, but a challenging consideration with the care economy, which is just the amount of variability there is between provinces and territories in terms of the care services that are provided, the populations that are providing care, the amount of people who are receiving care, right? This all very much varies depending on where you are. And it's particularly tricky in the care economy where you're having sort of this intersection of education, health, and social services, which are all very provincially dependent, of course. So in terms of the paid care services and policy supports, we face challenges when we look only at the national level in getting that level of detail. So that's maybe a more negative note or more sobering note, but maybe to look toward as well beyond Statistics Canada, what other type of care economy work is happening in Canada. And this is just to give you a snapshot of two of our stakeholders or partners who are doing work related to the care economy right now, both primarily on the national level, but just to give a sense of what else is happening. So on the one side, we have the Care Economies in Context project that I was mentioning before. This is run at the University of Toronto by Professor Ito Peng, funded by SSHRC and the Open Society Foundation. StatsCan is an institutional partner on this research project, and it is a multinational project on care economies in 9 different countries, including Canada. And so this research project has been looking at the care economy in a way that's aligned to the sort of conceptual framework that I discussed with you. They've also fielded their own surveys, focusing more specifically on elder care for those 65 and above, and then childcare for those under 15. And because they have the capacity to do this, not being the National Statistical Office, they've also looked at qualitative interviews and further survey follow-ups with the group of caregivers they're looking at. The second stakeholder I wanted to highlight is just the Canadian Centre for Caregiving Excellence. And so they have been consulted over the course of our project quite a few times and have hosted conferences on caregiving that some people here at the webinar may even know about. So they have also collected data from their own survey, specifically on caregiving for long-term conditions, disabilities, and problems with aging. So here I note that unlike our conceptual framework, this doesn't include all children, but this is a relatively common distinction to make in the caregiving space. And as I say, is sort of an example of when the care economy umbrella concept gets sort of separated apart. Their survey in particular tried to look at policy preferences, the opinions of caregivers, the needs for support, those kinds of sort of support and context elements to caregiving. And they're also doing qualitative interviews as well. And so again, I just give the example of these two projects to show what is out there, who else is working on it, that it's not just necessarily StatsCan who's interested in it, but that there is a lot of work, data collection that's sort of aligned at the national level, but that tries to specifically look at different areas of the care economy. And I want to close off by talking about, again, why care about the care economy. So now that I've given you all this information on the project and the framework we developed and the data that we have or don't have, what the concept of the care economy can actually offer to everyone attending this webinar. So I think the first and foremost reason that the care economy has become more popularized and more used and more discussed is that it really provides a more comprehensive look at how care impacts Canadians. And why I've emphasized this comprehensive approach is because we know that systems of care for paid care and unpaid care, or the care given to children or adults, these are all interdependent, they're interrelated, and they require one another. So looking at these separately is really limiting our ability to gain insight on how systems of care are functioning. So the care economy offers one, at least, umbrella approach to trying to approach this from the big picture and saying, how do these things function together? The care economy can also help generate new understanding of the impact of demographic trends, whether that be at the national level or at regional, provincial, or local levels. So a lot of the things that we've been talking about and that get talked about in popular discourse around population aging, falling fertility, higher immigration, looking at this from the perspective of the care economy informs not only what the sort of knock-on effects of some of these trends would be, but also how policies are crafted to try to address some of these trends. The care economy can also provide an important lens on a growing area of demand for the Canadian workforce, as I highlighted before, right, with long-term care, childcare, and other forms of social care in between. So how many work in care jobs? Is there a mismatch between the supply and demand? How do the policies around care workforces, how are they working or not? What is needed there? I've been trying to say, we tried as much as possible to separate out this overlap between healthcare and social care, of course, but what the care economy can also provide is sort of a new insight on strains on the system of healthcare as well, right? So how much does it overlap with social care, right? How much of healthcare is really acute and medical? How much of it is more this supportive or social care, which I'm sure many people at the webinar would know much better than I do. But also this angle of how much unpaid care work goes unrecognized in supporting these paid health systems. And really, what is the balance? Is it shifting more toward this unpaid care work? So the care economy can provide insights onto how this functions as well and how these systems are interrelated. And then the care economy, very important for understanding well-being, the economic well-being of Canada, societal well-being of individuals, especially given that caregiving is not sort of evenly distributed and that it's done by certain groups more than others. This well-being information can also help shape the knowledge on what kind of support there is for caregivers and for care receivers, right? Is it sufficient? Is it lacking? So those are some of the reasons I think that provide some motivation for why care about the care economy, and in particular, the sort of conceptual foundation that we presented today. And I want to end on just saying that as I said, this is a very high level sort of umbrella approach, big picture look at especially the data available in the care economy at StatCan. And just knowing that, again, because the care economy touches so many different little areas of where we collect data at StatCan, but also outside, I certainly can't answer every single question about all the different surveys I listed on that slide or administrative or data sources. So the Data Service Center information is available here and will be on the slides that are distributed, and can offer services that help organizations or determine how they could access data for their needs on this topic of the care economy. And if you have any questions, of course, we'll talk about them in the Q&A, but if you have any that you don't share today or you have any feedback, we really welcome you to get in touch. So I have Patricia's information here. She's the survey manager for time use and caregiving, and then my information as well. Thank you.
Thank you so much, Dana, for the great presentation and useful resources. We will share the presentation slides as well as the webinar recording on the Community Data Program webinar page in the coming days. So this is kind of the Q&A session. We have around 10 minutes for this session, and we already received a couple of questions, so I'm going to read it for you, and then anyone else would like to put their question in the chat box or they want to raise their hand and then unmute themselves, please do that. So the first question is that, do you use NOCs and NAICS for classifying jobs within the care economy? And if so, do you have a diagram chart of the groupings of job codes?
That's a great question. So at various points in the project, we've explored the idea of sort of providing these codes. We don't have a list necessarily. There has been a lot of research internationally by the International Labour Organization, but also more locally, there are researchers out there who are compiling lists of these codes and using them. But because there's so much variation depending on exactly what one person considers the boundaries to be, and what kind of data, like to what level are the data available in the different data sources, we didn't put it in the conceptual foundation necessarily, as we thought that got a bit more into sort of the data gaps, the data mapping, which wasn't as much included in the report. So no, not necessarily a diagram or chart, but if you want, I'd be happy to share some of the resources we found and how different researchers or organizations conceptualize these different lists, essentially, of NOC and NAICS codes.
Awesome. Great. So we have another question about the charts and tables. So do you have interactive diagrams or tables on this data that can provide historical context to current day statistics?
So yes, again, because there are so many data sources that kind of make up the different parts of the whole of the care economy. So again, speaking because I work on the general social statistics program, which is more on unpaid care, StatCan does have tables available online, let's say on the time use survey, where you can look at how much unpaid care is provided. On the caregiving and care receiving survey as well. And then there are tables available on the paid care work side from things like the LFS, right, which would provide more information about that. But because this care economy project is, well, it's 3 years old now, but that's fairly new in the context of such a large organization. We don't necessarily have, apart from that resource on the Gender Diversity and Inclusion Statistics Hub, we don't have like a specific set of interactive data tables on the care economy more generally. It's more sort of piecing together the different sources for now. Yeah.
Okay. So if you have any follow-up questions, you can raise your hand and unmute yourself, or you can put it in the chat box if anyone has any other questions. This is kind of, we have around 6 minutes to kind of close this webinar. So while people just maybe putting their questions in the chat box, I would like to mention about our future webinars and community data program. So our next webinar would be Community Data Program Orientation, which will take place on April 23rd, 1:30 to 3 p.m. Eastern Time. So we encourage members who are new to the program or need a refresher to join us to learn more about the program, data consortia, and member organization. We'll also have a website demonstration live as well. So I'm going to share the link in the chat box for anyone that would like to register for that. We will have 2 other webinars, April 30 and May 14th. We will publish it on our website and then promote it on our MailChimp. So it's kind of the Statistics Canada webinars will be presented with the StatsCan team. So make sure to check our webinar page regularly. And also, if you subscribe to our newsletter, you will receive at least 3 weeks before the webinars to register for the kind of presentations. And if you have any questions about the community data programs webinars, I would encourage everyone to reach out to our team at information@communitydata.ca that I put it in the chat box. Okay, so we received another question. Says, is there a desire? Are there any strategies in the works to fill in some of the gaps you mentioned, such as knowing what tasks are performed?
That's a great question, and that's why I did mention the other sort of care economy related work going on in Canada, and there's also work going on internationally that I didn't necessarily mention, but those different organizations or groups or researchers are really looking to find ways to fill in the gaps, especially with paid care work, since it seems to be so tricky about exactly where the boundaries are and who's included and what type of tasks people want to know about. But at the moment, that's all I can really share from the StatCan side. Really, right now it's more a question of, with the sort of rich amount of data that StatCan has that's sort of distributed across, what can we tell from this to start off, and then that might motivate future interest down the road.
Great. That's great. Thank you. Does anyone has any questions? So please feel free to put it in the chat box or unmute yourself and ask the questions. We have around 3 minutes, less than 3 minutes to close the call, but it will stay online in case anyone has any other questions for a couple of minutes. If not, I would like to thank Statistics Canada team, Dana, for the great presentation and the detailed explanation about this valuable project. And also thank you everyone for joining us. And I hope you have a great rest of your day.
Thank you very much for the invitation to come here, and